So let's get started and let's jump in by introducing the speakers for the panel today. I'm going to pass the mic to my colleague, Lisa. Lisa, could you please just introduce yourself quickly?
Thank you, Emily. A very good morning, everyone. Isambu Vinaka, and happy to be joining in from the Pacific Disability Office in Suva. So glad to be here. Thank you, Emily.
Thanks, Lisa. Over to you, Aarti.
Thank you. Good morning, everyone. I'm Aarti Devi. I'm the database officer for the Pacific Women Lead program, and I'm very happy to be joining you all from the SPC office in Nambuwa.
Thanks, Aarti. And over to you, Sal.
Thanks very much, Emily. Hi, everyone. My name's Sally Baker, and I provide disability inclusion support to Pacific Women Lead. And I'm calling in from the land of the Wurundjeri people in Melbourne, Australia. Thanks.
Thanks, Sally. And finally, I'm Emily Miller. I'm part of the MEL team at the Pacific Women Lead Enabling Services. So thank you once again for joining us. And I am going to start by sharing my screen so that we can jump into the content. So you've joined us today on a webinar around disability inclusion, and our objectives today are really to share not only some introductory information around why disability inclusion is obviously important, but to share some of the guidance notes that we have produced as part of the Pacific Women Lead program, in particular drilling down into the Washington Group short set of questions and how we are using or hope to improve the use of the Washington Group questions across the Pacific Women Lead program. So jumping straight in, I am again going to hand over to my colleague Lisa, who's going to take us through some of the beginning slides on disability inclusion and why it's important. Thanks, Lisa.
So for us this morning, it's important before we talk about how we are monitoring the inclusion or the level of inclusion of persons with disabilities in the program, is to have a brief background on understanding of disability from the context of the Convention on the Rights of Persons with Disabilities. And that is the foundation of all the work around disability inclusion or equity. And so in the definition or in the purpose, people with disability is referred to as people with long-term, and watch the different words used here. One is physical, mental, intellectual, or sensory impairments, which in interaction with various barriers may hinder full and effective participation in society on an equal basis with others. So long-term physical, which is going to be discussed in the Washington short set, so it would refer to those with physical disabilities related to mobility, whether it's moving from one place to another, and also related to the work to activities such as self-care with the use of the upper limb or the use of our hands to support us with those activities. So it would refer to that as physical disabilities. Mental disabilities in the earlier years on the development and the discussion around on the Convention on the Rights or the CRPD was the use of the word mental or mental disabilities, but later on now more inclusive and non-very discriminatory is the use of the word psychosocial. But mental disabilities would refer to those with bipolar disorder, whether it's due to stress and anxiety, would be mental disabilities. And then we have intellectual disability. And in this case, when we refer to intellectual disabilities, you would be aware of autistic children or children with Down syndrome who may not be not only children, but also adults with disabilities who may not develop at the same rate compared to their other peers, would be intellectual disabilities. And then we have the sensory impairments. And this refers to sense of touch. I talked about the use of the upper body, upper limbs. Sense of touch, and then we have sight for everyone with vision or visual impairment, and then we have the sense of hearing, those with hearing impairment. So the disability results from the interaction of the daily activity or the daily functioning with the barriers, okay, that may hinder the full and effective participation on any activity in society. So disability arises not only from not being able to see, to walk, to hear, to remember or concentrate, and to do self-care activity like washing, feeding, but from the interaction between my not able to do those basic activities with the barriers that presents itself to me in the community or in society. So one of those barriers is attitude, and this is all across, whether it's all across the Pacific at the community level, at the institutional level, at the office level, the stigmatization or discrimination towards people with disabilities. We still have that attitude and stigma for persons with disability. Because you have a disability, you can be looked at differently and may not be believed that you actually have a potential or skill set. The other one is barriers to accessibility to built environment. And if you could, for those of us who could see the screen, it has a sign of the wheelchair with a set of flights, a set of stairs. So the barrier is the set of stairs, and my not being able to walk, I may not be able to get into a school if the school has those set of stairs, or if an office has a set of stairs, or even if the hospital or the bank, or even going to any other office that we wanted to go to. So those environmental barriers is what prevents persons with disabilities from accessing services or to be included. And then we have the institutional barriers, the discrimination at the law, at the legislation level. And we know very well all across the region, in terms of everything done after the ratification of the CRPD, one of the main, state obligation is to ensure that our laws are aligned to the CRPD. So discrimination starts at the legislation level or at the laws, with the policies as well. And those of us who work in the space knows about this as well, on whether it's silent on the inclusion of persons with disabilities, or it's not there at all. And then we have practices. It may be inclusive on the law where it references persons with disability. It may be inclusive on the policy, but it is not implemented in terms of what should be done. So sometimes practices can still be very discriminatory, and that hinders, and that is also a big barrier for persons with disabilities to be included, to access service, or to participate. And then we have communication, inaccessible, whether it's written or verbal information. For some of us as persons with disabilities, not everyone, like for those with vision impairment, those who cannot see at all, or those who have partial. So anything that comes around in the soft copy is not accessible. So how do we make information accessible to those who cannot read from their screen? And then the communication is not accessible. Not everybody can hear. And so there are those hearing and non-hearing. For somebody who is deaf, without a sign language interpreter, they won't be able to go to school or be supported at work or to participate in a meeting like this. But for our meeting today, there's closed captioning, so they're able to read. So that's on the barriers and the definition. And I'll hand it back over to you, Emily.
Thanks, Lisa. It's actually over to Sally. Sally, can I hand this over to you?
Sure. Thanks very much, Lisa and Emily. So in response to these inequities, actually, sorry, no, we're one screen ahead. So sorry about that. So thanks, Lisa, for talking through the barriers. So the World Health Organization reports that around 16% of people across the world experience disability. That's over 1 billion people worldwide and about 1.7 million people across the Pacific. There's a strong link between disability and poverty, and that's caused by the barriers that Lisa just spoke about that prevent people with disabilities from accessing key opportunities, including education, employment, and health services. An example of this is less than 10% of Pacific children with disabilities attend school, compared to 70% of children who do not experience disability. There's a big gap. In response to these inequities, Pacific Women Lead seeks to reach and benefit people with disabilities alongside everybody else. Its goal is that Pacific women and girls in all their diversity are safe and equitably share in resources, opportunities, and decision-making with men and boys. Pacific Women Lead has three main outcome areas which focus on women's leadership, the realisation of women's rights, including sexual and reproductive health rights, and regional effectiveness and ownership. We'll have a look now at some of the barriers which have historically prevented people with disabilities from benefiting from these three outcome areas. So first, looking at women's leadership promoted. So Lisa talked about attitudes, and things like social norms, stigma, and discrimination prevent many women with disability from participating in leadership opportunities. Systemic barriers and exclusion lead to lower economic and social status, including lower civic and political participation. Lisa also talked about the laws and policies, the institutional barriers to participation, and laws and policies addressing gender equality have traditionally excluded the rights of women with disability. And these barriers, coupled with a failure to prioritise the collection of data about women and girls with disabilities, so therefore a very thin evidence base about the issues facing women and girls with disabilities, perpetuates their invisibility and marginalisation. So next, if we have a look at women's rights realised, many women with disabilities face insurmountable, sometimes insurmountable barriers to accessing sexual and reproductive health rights services. People with disabilities are especially at risk of experiencing gender-based violence, and there's a lot of emerging evidence now showing us that that is the case in several Pacific countries. Policies to address gender-based violence experienced by people with disabilities exist in many places, but lack implementation strategies or monitoring or processes for enforcing them. Service providers and families often make decisions on behalf of people with disabilities, and this is very present in the sexual and reproductive health space. Social attitudes sometimes condone violence against women with disabilities. And finally, looking at that third outcome area, regional effectiveness and Pacific ownership. So organisations of persons with disabilities, or OPDs, are in place across the Pacific, and these advocate effectively for the rights of people with disabilities. And we have Lisa here representing Pacific Disability Forum, which is the umbrella OPD for OPDs across our region. There is limited access to resources, and capacity constraints within OPDs, however, are an ongoing challenge to their sustainability and engagement. Gaps in alliances between OPDs and women's rights organisations can result in the rights of women and girls with disabilities being overlooked during the development of programs. So there's a real gap in information that supports action in the three outcome areas of Pacific Women Lead. Thanks, Emily. Next slide. So in response to these gaps and issues, Pacific Women Lead engaged technical assistance in disability inclusion and formed a partnership with Pacific Disability Forum. As an entry point to addressing the issues, Pacific Women Lead began influencing and strengthening disability equity and rights across its portfolio of work, including the work of its grantee partners, by first strengthening disability inclusive data collection, reporting, and monitoring. Addressing barriers to the inclusion of people with disabilities requires understanding the experiences of people with disabilities first. Without this understanding, there's a risk of planning and implementing activities that further isolate and marginalise people with disabilities. Understanding the experiences of people with disabilities requires first identifying people with disabilities and then exploring the barriers and enablers of their participation. When we have disability data, we can use it to assist with monitoring participation. Thanks, Emily. So looking next at reporting on disability inclusion. During a participatory analysis of grantee reporting early last year at Pacific Women Lead, we found that when partners were reporting on disability inclusion, they mostly reported on the enablers or the preconditions to participation. There was a little bit of information provided by some partners regarding the number of people with disabilities who had participated, but very little relating to participation or outcomes resulting from disability inclusion efforts. So in response, we developed and tested a guidance note to support partners to collect and report on the different types of data that we thought were required to really tell the story of the engagement and support to people with disabilities to enable their achievement of outcomes. The image on the screen is from the guidance note that we developed, and it demonstrates how reporting on 3 different types of data can help a program tell its story of the enablers it's putting in place, the outcomes of this. And the guidance note is available online, and I can see that it's been shared in the chat. So thank you very much for that, Emily. Next slide. So firstly, we'll have a quick look at preconditions or the enablers. Preconditions are the enablers of inclusion, and they include things like engaging sign language interpreters, engaging personal support workers or caregivers of people with disabilities. So that means having some funding available to enable the engagement of support people who can make the difference between participation and not participation for people with disabilities. Another type of precondition is having accessible venues. Sometimes they might be a little more expensive, so it's important again to have some budget provision for that. Another example is putting information into accessible formats to overcome those barriers to information that Lisa explains so well. Preconditions or enablers can also include partnerships with OPDs, and these are a really important enabler of efforts to achieve disability equity and rights, because nobody knows the experiences, barriers and enablers for participation of people with disabilities better than people with disabilities themselves. Thanks, Emily. If we look now at reporting on inclusion. So reporting on inclusion data involves reporting quantitative information relating to the number of people with disabilities participating, for example, in a meeting, or the number of women with disabilities attending a sexual reproductive health service. Ideally, we might see the number of people with disabilities receiving a service or participating in an activity to be increasing over time. So, collecting quantitative disability data requires us to identify the disability status of individuals engaging with our activities. The most obvious approach to this would be to ask everyone a yes or no question, something like, do you have a disability? Next slide, thanks. However, and I know there are lots of people on this call who will be saying, no, that won't work, and you're right. Questions such as, do you have a disability, or what type of disability do you have been shown to be ineffective and result in some cases, quite massive underreporting, because sometimes the word for disability in different languages is viewed negatively or is not understood by communities. The idea or the concept of disability might be associated with stigma and shame in some contexts, and people might not want to disclose information. So if somebody who feels ashamed about experiencing disability, if they are asked, do you have a disability, their instinct might be to just say no. And people might not identify as having a disability. For example, if they view their difficulties or their impairments as a typical part of aging. So there was a really great study that came out of Uganda, maybe about 10 years ago now, which used the Washington Group questions, which we're about to talk about, and the question, do you have a disability, in the same study. And what they found is when people were asked, do you have a disability, only 2 to 3% of the population responded yes. However, when using the Washington Group short set, which we're going to talk about now, the prevalence was more like about 11%. So to address that problem, international agencies, together with national statistics offices, formed a group called the Washington Group. And their first meeting, there's no prizes for guessing which United States city that first meeting was in. Yes, it was Washington. The Washington Group developed a set of 6 questions that ask people about their basic functions or what they can do, such as whether people have difficulty walking, seeing, or communicating with others. There are 4 response categories, and those include no difficulty, some difficulty, a lot of difficulty, and cannot do it all. Anyone who answers a lot of difficulty or cannot do it all most likely experiences disability. However, some people who answer some difficulty may also experience disability. These questions have been found to be a much more realistic approximation of disability, much more reliable than responses to the question, do you have a disability? So the questions, the 6 Washington Group short set questions are on the slide, and I'll just read them out in case they're hard to see. So the first is, do you have difficulty seeing, even if wearing glasses? The second is, do you have difficulty hearing, even if using a hearing aid? The third is, do you have difficulty walking or climbing stairs? The fourth is, do you have difficulty remembering or concentrating? The fifth is, do you have difficulty with self-care, such as washing or all over or dressing? And the sixth is, using your usual language, do you have difficulty communicating, for example, understanding or being understood? Anyone who answers a lot of difficulty or cannot do it all most likely experiences disability. And just, sorry, Emily, if you can just stay, thanks. So the first 2 questions you might notice have an extra bit on the end. So the first one is, do you have difficulty seeing even if wearing glasses? And often when working with different organizations, I ask the question, why is that there? And in the second question, why are people asked even if they're using a hearing aid? And the answer is because glasses and a hearing aid can make the difference between experiencing disability and not experiencing disability. So for example, I use myself as an example when thinking about this. So I have quite bad eyesight and have worn glasses for a really long time. Lucky for me, I was born in a place where I could access vision testing and glasses easily, and so it has never impacted on my life. However, if I had been born in a rural or remote island or a location in a Pacific country that wasn't in the capital or in an urban centre, it's possible that I might not have had access to vision screening and to glasses. And as a result, I would probably answer that question differently. So right now, if somebody asked me, do you have difficulty seeing even if wearing glasses, I would answer no, no difficulty. And I wouldn't be counted as a person with disability. However, if I lived in a rural or remote location and had never had access to supports, I would answer that question, yes, a lot of difficulty, or even yes, cannot do it all. As I get older, my eyesight declines. So you can see that there are contextual, that the context makes a real difference sometimes in the way people are going to answer these questions. Thanks, Emily. The questions can be asked of people in a person-to-person survey or included in questionnaires, enrolment forms, and evaluation forms. Pacific Women Lead asks partners to use the Washington Group short set when collecting quantitative data that targets individual women or girls. And this could be through the provision of services. So for example, crisis response services or sexual reproductive health services, or through activities such as the delivery of training or workshops. And you might find that at the end of this webinar, when you're diligently completing the evaluation form, the feedback form that Emily is going to ask you to complete, you'll find yourself asking the questions too, answering the questions too, sorry. There are a couple of limitations with the questions, and one of these is that they don't identify psychosocial difficulties. Those are mental health difficulties, and Lisa referred to those earlier. However, the Washington Group has been busy and has also developed additional question sets too. So there is an extended set of questions that does include other questions that look at other types of difficulties that aren't covered well by the Washington Group short set. There's a question in there on using hands and fingers, which can be useful in some settings. There are questions there too that relate to psychosocial or mental health difficulties. So using the Washington Group short set to data to monitor inclusion. The Washington Group short set can tell us about the reach and coverage of the program. For example, is the program reaching people who experience different types of difficulties? Seeing, hearing, self-care, mobility, remembering. Are people with diverse difficulties or disabilities well served by the program? Or is our program a bit more focused on people with particular difficulties or impairments? The Washington Group short set can help tell us also about the impact of the program. For example, is the engagement of people with disabilities increasing or decreasing? They can only really tell us about quantitative information though, and so if we want to know more, and I think we probably do, we need to do some qualitative work to explore what the outcomes are for people with disabilities. The Washington Group short set can also tell us about groups that are being left behind. So, for example, are there people with specific difficulties who aren't included? And this is often the case with people who experience less visible or less obvious disabilities. For example, people with intellectual disability and deaf and hard of hearing people. So for my last slide, I just thought I'd share an example from the Vanuatu Skills Partnership report from a couple of years ago. So Vanuatu Skills Partnership was an early adopter of using the Washington Group short set in its client database. So every individual who participates in skills development activities that are implemented by Vanuatu's training providers or through the various government ministries, every client completes a client information form, which includes the Washington Group short set. We have translated the questions into Bislama and tested them and worked with the Ministry of Justice's Disability Desk Officer, which is the Government of Vanuatu's National Disability Focal Point. And we've also worked with the OPD in Vanuatu to establish a set of questions in Bislama that are accepted. And these were the same questions that were then used in the census a few years ago. So as a result of using these questions, we can track the inclusion of people with disabilities over time. And in this snapshot on the screen, we can show disaggregated and reported disability data that's been disaggregated by gender, the skills sector that the people with disabilities were engaged in, and province. So if we look really closely, and I apologise that it's quite small, we can see that most people with disabilities who are engaged participated in agribusiness activities, and then the next most common was creative industries. We had slightly more men than women, and looking at the map of Vanuatu, we had really high participation from people with disabilities in Torba province and in Ambai, and less in Tawhea and Malampa. So that information is interesting to us because it can tell us things that will help us with our planning for our next period of implementation. I'll now hand over to Emily. Thanks.
Thank you, Sally. I just want to stop. So we were going to stop to answer any Q&As. We don't have anything in the actual Q&A box function yet, but I wanted to, they're all coming in. They're all coming in. Excellent. Okay, so we'll just stop for a couple of minutes to answer some of these questions. So good morning. Are you able to please advise what extended set provides or requests or collect information on psychosocial and mental health difficulties as mentioned by Sally? So are you able to provide a little bit of information on the extended questions for people, Sally?
Yeah, thank you. It's a good question. So the extended set offer questions about different aspects of psychosocial or different aspects of, I guess, feeling, emotions, thinking and behaviour, which can be collated to give a perspective on whether somebody is experiencing difficulties in that regard or not. It's important, I guess one thing I haven't said that I really need to say is that the Washington Group questions are not diagnostic. So we can't ever use them to diagnose disability. That's the job of the health sector and health professionals. What the Washington Group short set and the other sets as well can tell us is risk of disability by telling us about the types of difficulty with a focus on function. So when it comes to psychosocial disability, it is quite tricky to use the Washington Group short set or any sort of set to identify a diagnosis of what the mental health difficulty is. What it can tell us though is the areas of function or activity that people are having difficulty with. I'm happy to, while Artie's talking in the next section, I will find the link to the extended set and put it into the chat.
Thanks.
Sorry, Em, I'll also mention there's also the child functioning module, which is a set of questions which are recommended for children aged between 5 and 17. The Washington Group short set can be used for children aged 5 and up, but the child functioning module is much more targeted to children, because, you know, as children are still developing, it's a bit trickier to identify risk of disability amongst children who might not be experiencing disability, but just be developing at a different pace to other children.
Yeah. Thanks, Sally. And there is another question, but before we go to that question, I just wanted to ask, and I think it might be worth just reiterating with the Washington Group questions, when someone actually is identified as having a disability and what their response needs to be in order to be identified as someone with a disability. You did cover it briefly, but maybe just stressing that again in terms of for people in the room.
Oh, so how we determine disability using the
Right.
response category? Yes. So yeah, thank you. So the Washington Group guidelines say that looking at the 4 response categories, so no difficulty, yes, some difficulty, yes, a lot of difficulty, and yes, cannot do it all. That if someone answers a lot of difficulty or cannot do it all, they are definitely counted as a person at risk of disability. Remembering again that the Washington Group short set provides a proxy for disability rather than a diagnosis. If someone, I guess there's emerging evidence and a couple of papers that have been published recently that have referred to this, and certainly my observation is this is true as well, is that sometimes when people answer some difficulty, particularly in some contexts, that sometimes that category can capture people who do also are probably experiencing a lot more difficulty than they're reporting themselves. And this might be because people feel maybe people have just been coping really well for a long time without services or supports, and so they don't feel that they experience difficulty to that higher level. It could also, and it could also be a personality factor as well, people not wanting to report on to say that they're having a higher level of difficulty. So sometimes it's useful to look at the responses in that some difficulty category as well. And in the Vanuatu Skills Partnership, what we do is we add an additional couple of questions, which are not in any of the Washington Group sets, but they ask people about whether they use assistive devices and then what supports they might need to participate in skills development. And that sometimes then, if we have people who've answered some difficulty, but they have identified that they would need supports, the types of preconditions or enablers that I referred to earlier, then we go back and talk to them and find out a bit more information, because that gives us a bit of a guidance to know that, okay, I think that person might actually be experiencing more difficulty than they've reported.
Thanks, Sally. So there's a couple more questions, so I'll get to them. Some of them are a little bit longer, so if I'm not asking the question properly, I will take you off mute, or if Sally or Lisa, if you need some more information, I can take the person off mute as well who asked the question. So we have a question. My impression is the Washington Group short set is often used to produce a single figure of number of people with disabilities rather than further analysis of particular impairments and then understanding who might be being left out. Are there tools or guidance you recommend to help this kind of analysis? And does it require further info about expected prevalence of various impairments, e.g. number of people with vision impairment in a community versus the number of people being reached through a program or activity?
Yeah.
Does that make
Great.
sense? Yep.
Yeah, it does. Thank you. And thanks for the question, Catherine. Nice to see that you're here. So I'm going to, Artie, I'm just giving you a heads up that I'm going to ask you if you'd like to speak to this in a moment. But so I think it's a really good point. And I think for, you know, for a long time after the Washington Group short set sort of came out, I think when programs that I observed were using them, they were producing a single figure of number of people with disabilities, just as you say. But it is, I think, and I'm not a spreadsheet or data guru, this is why I need Artie to step in, but my understanding is it's actually not that difficult to build, you know, behind the database, a process of analysing the data so that we can be reporting according to difficulty type. And certainly, you know, the image I showed you from Vanuatu Skills Partnership was from 2021, I think. But what we're doing now is exactly that. We have back-end analysis that enables us to be reporting on type of difficulty. And what we do is, what that tells us is, I mean, we look really for big gaps. So if we have a higher number of people with mobility difficulties and hardly anyone with difficulty remembering and concentrating, that tells us something about where we might need to focus our efforts, and maybe we need to do some more work with the OPD to really be trying to find and reach people with those kinds of difficulties. I think your suggestion there about using census data or demographic survey data to look at the spread of disability across different impairment or difficulty types is really smart, because it can give you a sense of, okay, well, in this context, if you take a context that's like Cambodia or Afghanistan, which is, you know, post-war, there probably are a lot more people there with mobility difficulties compared to other types of difficulties. So census data can show us the spread of disability across those different difficulty types and help us understand what's a reasonable proportion, how many or what proportion of people should be people with mobility, people with vision difficulties, people with hearing difficulties. So thank you for that question/suggestion, because I think it's a really good idea. But Arti, did you want to speak to any of that back-end analysis, given you've just built a spreadsheet that's going to enable Pacific Women Lead to do exactly this?
Thank you, Sally, for that. So yes, we will be talking about this after the Q&A section, but for PWL, we also identified these exact things as a gap from our end. So what we did, we implemented two solutions. One was updating our own system for quantitative data that we were getting, but also acknowledging that while we're getting the number of people who were in an event or participating, etc., we also want the data behind that, more like information behind that, an actual narrative, what worked, what didn't work, why are people being left out. And we could, from our previous reportings, we could see some of that coming through, which is what encouraged us to sort of implement these solutions. And we will be talking about it in the later section.
Thanks, Arti. We have actually had quite a few more questions come in. So what I'm going to do is we'll try to get through two more, and then we do have a Q&A at the end as well. So we will keep those questions and come back to them at the end. I want to just also acknowledge that, that Lisa has direct messaged me on the webinar chat to let me know that her internet is a bit unstable, which is why she's turned her camera off. Lisa, if you do want to answer any of these questions, please just let me know, and I'll make sure you put your hand up or put your camera on, acknowledging that your internet could be a bit unstable. The next question, so diabetes is considered a disability in the American Disabilities Act. How has that discussion been in the Pacific with the high NCD numbers around the region? So,
I can have a try on that one now, Emily, if that is okay.
Of course, please.
Okay, thank you. So yes, that is very true for us in the Pacific in terms of the NCD. But when it comes down to things like amputation because of your NCD, in our own experience and the work with the OPDs, at one point in time, you were walking comfortably and well. And then at another point in time, you lose your lower limb because of diabetes and probably might have to rely on a pair of crutch or wheelchair. And identifying to be a person with disability is quite difficult because one is probably the acceptance that now you cannot walk and you identify with a population called a person with disability because of your mobility. While from the outset, yes, when it comes to difficulty walking, it can be very challenging or not possible at all. It comes down on how a person relates to that shift in terms of can walk at one time and a difficulty walking or not able to walk at all. But when it comes to senses, that is captured as a lot of difficulty or cannot walk at all, they are captured as persons with disability. But it's different when you deal with an individual. How do they identify in that case? That would be my quick answer to that to the question, Emily.
Thanks, Lisa. I'm going to ask one more question, and then we'll keep moving, and I'll keep the questions for the end. But Sally, maybe this one for you. So I trialed using the Washington short set of questions in the Pacific The early questions related to seeing and hearing were clearly answered by participants, but the data for later questions related to concentration and/or being understood seemed pretty wild, with 40% or more respondents agreeing to those questions. So it seems they were not well understood. Do you have further guidance on use for these questions?
Yeah, thank you. I've certainly seen that happen when the response categories were changed. So, yeah, a few years ago, I was asked a really similar question by a program, and when we looked into the tool that was being used, the program had adjusted the 4 response categories to just say use yes and no. And as a result, they had huge over-reporting, particularly in that remembering and concentrating question. It was something like 40 or 50% of people said yes, they did have difficulty remembering or concentrating. If in your case you are using the 4 response categories and still getting that kind of data, then yes, it is suggesting that maybe the questions aren't being well understood. And in which case, yeah, I'm not sure where you're working or where this happened, but looking at the translation can be important. The Washington Group Quest short set has been cognitive tested in all regions of the world, but as we know, each specific country and context is really specific and different and individual. So it is worth going through a process of testing the questions locally in whatever is the most used language, and with different stakeholders involved. So I would say definitely the OPD and the Disability Desk Officer for the government. So lots of disability desk officers now have a set of questions which have been kind of approved for use in censuses in their country, and lots of countries have used the questions now within their censuses. So it's worth just cross-checking with them about how they went, and maybe doing some further pre-testing of the questions in local language before rolling them out as part of a data set.
Thanks, Sally. So I'm going to keep a track of the questions. We will come back to the ones that are yet to be answered. But to help us make sure we get through all the content, we're going to continue on, and I'm going to hand the mic over to Arti. This is the part of the webinar where we are specifically talking about Pacific Women Lead and what we've done to address and strengthen disability inclusion and some of our reporting requirements. So over to you, Arti.
Thank you, Emily. So I'll start with some learnings that we had from the previous iteration of the program, which was Pacific Women Shaping Pacific Development. And we don't feel embarrassed about acknowledging the fact that we did not do well as a program when it came to reporting on disability inclusion. There were a number of factors that affected this. Some of those were we did have some good emerging practices, but the program was unable to share this widely. Some of those emerging practices were from our existing partners, etc. But there was a lot of, a lack of convening spaces to share those experiences and practices widely. And towards the end of it, when the team was building onto all that, COVID did happen as well. We did not have any qualitative analysis software to tag and track progress. And also, we were asking the question wrong as well, and our system was recording it incorrectly as well. We were doing what Sally had just told previously not to do, which was asking a yes and no question. And beyond that, we were not asking anything further. We did not use Washington Group short set at all. This is an example of what we used to do. Just observe the language we're using, etc., and how we were collecting data. So when we would expect our partners to report back to us, we would pool persons, women and girls, men and boys without disability in a completely different category, and then pool women, girls, men and boys with disability in a completely different category. So if you could see, we would say women and girls aged 17 and younger, 15 had a disability, aged 18 and 35, without a disability, 15, 18 to 35, 5 had no disabilities, and women aged 36 and over, 20 women participated, there were no disabilities. And women, I apologize, that's total women, not women without disabilities. And women whose age were not specified, but we knew they attended, with or without disabilities, were 2. And then in a separate corner, we said that there were 5 women and girls with disability. So out of the women and girls that we had reached, which was 15 plus 5 plus 20 plus 2, if you add all of that, 5 of them actually had some form of disability. But the way we collected this data, we had no idea which age groups they fell in. So the only viable thing we could do at that stage was to pull all of them as no age group specified. We did that. We have collected your age groups, but we will tag you all as no age and then specify the total number of women attended minus 5 into having disabilities and no disabilities, which would have meant that we would lose the good data we had by age groups disaggregation. So most of these numbers, even though we had space in the database to put them in, the way we collected and designed our annex, these data mostly just ended up in a comment section, which never made it to analysis. Also note that in our database and annex, we're using language like girls living with disability, which we have evolved into learning is incorrect. So as soon as we transitioned into the Pacific Women Lead program, we had identified this as a gap. Sorry, Emily, can we go one slide back?
Oh, sorry.
We had identified that the way we were collecting data was wrong. But even at that time, we did not have the expertise and understanding of implementing the Washington Group short set of questions. And neither was our database or any of our systems configured to take those entries in. So the immediate correction we did was, while continuing with the yes or no responses, we moved the girls and women and boys and men disability responses into the actual main group, so that when partners were reporting, at least they were consistently putting the numbers in the correct places and we were not losing that. Also note, at this point, our language is still very, very wrong. We were still learning. Thanks, Emily. Next one. So if you see this, the top table is the analysis of all the numbers that we had gathered, which were correctly reported based on disability. And at the bottom, we have the numbers that have been reported for the past 2 years. So from the top table, for the entire life of the program, we had only managed to collect 2,244 participants that we had reached with disability, with pretty much no stories or understanding of what their participation were in, and how much of it was accessible, meaningful, etc. At the bottom is 2 years of data that we have collected, which is just by switching the columns of how they were reporting back to us. And for that, we have collected 2,206 responses. And from that, we had also identified the narratives that were coming behind that, and implemented a qualitative software as well, so that while we collect this data, we also tag the responses from the narrative into our qualitative tool. But now, moving forward, we will be using these. So the previous annexes, the previous data collection tools that we had been giving to our partners are completely gone. Now, for all the data that we expect coming back to us, needs to have the responses in by Washington Group short set of questions, which means the expectation is that we need this data, so we would also expect our partners to start learning and implementing this in every event, workshop, or work they do. And we would be assisting with building the capacity around that. We have also changed the way our database collects that information, which is at the bottom. The responses that we get will be analyzed and stored according to the different types of disability. And then we also have a qualitative software which captures the narrative that comes for these data, which we will record. So we both, what we do under PWL is that we combine both quantitative and qualitative data, and these we include in results chart, which we then present back to our stakeholders in our annual convening, which is where we do deep dives about disability inclusion and the work we've done so far, the work that our partners are doing, learning and sharing, and discussing how to take the work forward. Also ensure that our partners are identifying recommendations of for how disability inclusion can be strengthened each year in our reflection workshops, and monitor the implementation of these recommendations on quarterly basis and report back to stakeholders each year. Emily, you want to take it forward for the next slides?
Thank you, Arti. So I wanted to just extend on what Arti has said and really reiterate that it has been a journey for us as a program as well, as Arti mentioned. You know, it can be difficult to be changing systemically how your program is collecting data, using data, analyzing data, and it has been a journey over a number of years for us as a program. So that's just really to reiterate and to support the message that we're all trying to do better. We also have changed our reporting templates, our narrative reporting templates in particular. So Arti's talked about how we've changed quantitative data. We have also changed our reporting templates to break the question up and ask about disability in a slightly different way. Previously in our reporting template, we just used to ask people, tell us what you've done to in relation to disability inclusion, which is a very general, very big question for people. And often we weren't getting much detailed information. The question wasn't supporting people to be really specific. So we have broken up and we're asking more questions about disability inclusion and trying to make them more specific. So we are specifically asking in our reporting, what support has your project put in place to enable the participation of people with disabilities? So that is really trying to get to the preconditions that Sally spoke about earlier, really getting people to identify where sign language has been used, where accessible venues are always being used, where partnerships with organizations for people with disability are taking place. And then we ask another specific question around, has your project collaborated or worked with any regional or local organizations for people with disability during this reporting period? Because we're really trying to signal to our partners, we want you to be working with OPDs. That's a really important part of making sure your program is disability inclusive. And then we also ask for partners to provide information specifically on what benefits are people with disabilities reporting as a result of your program. So where you are reaching them, how are they benefiting from the program? And we make sure that as a program, we collect impact stories across the portfolio, and we make sure we specifically go out to work with partners and collect stories that relate specifically to reach for people with disability and benefit that people with disability are experiencing as a result of the program. So yes, that's really, I think what we can do now is really look at some of the questions that have been asked in the Q&As, because we do have quite a few more there. So I might actually, actually quiz time, Sally. Did you want to do quiz time before we jump to the last Q&A? I'm sorry, I missed that quiz time. I'll stop sharing my screen.
Sure, I'll get that happening. And that might prompt some more questions too, although I can see there's lots coming in.
Yes, there is.
Great.
We want to leave plenty of time for these questions.
Yeah, exactly. Okay, so hopefully people are viewing a slide that says quiz.
Yes, we can see that.
Great. Okay. So this is this quiz uses a program called Menti. To participate, you can, if you have a smartphone and you have it next to you, you can use the QR code to access the quiz, or you can enter, on your computer or whatever device you're using, you can enter www.menti.com and then enter the code, which I'll read out a couple of times just to make sure people are getting it. It's 77186174. And I'm just going to sign in as well. Okay, once you're signed in, if you can give a thumbs up That would be great. Now, for if this isn't working for you, that's okay. You can I think, do people have access to the chat function, Em?
No, they don't, Sal.
Oh, okay, all right.
I'm not sure. I do have two people with their hands up, which I may Cornelia, go ahead. I've enabled you to talk if you need to. And Sheila as well. I've enabled you to talk. I can see you have your hand up, so please go ahead if you would like to. You are both just on mute.
Yeah, just wanted to say what was already said, that we don't have access to, you know, the reaction or the chat function. Over.
Okay, all right. Yeah, I'm sorry about that. Okay, well, I mean, you won't really miss anything by not being able to participate. You just won't be able to share your your ideas in response to the quiz, but we're going to talk through all the questions anyway together. I should say that participation in Menti is completely anonymous, and we won't know how anyone's responded to anything. All right. So if you've got Menti open and you can answer this, please have a look at the question. I'll read it out. According to the Washington Group short set, how does someone qualify as a person with disability? And we've got three options. And if you can't use Menti, that's okay. You just think about it and decide for yourself which one you think the right answer is. The first answer is if they answer some difficulty, a lot of difficulty, or cannot do it all. The second answer is if they answer cannot do it all. And the third option is if they answer a lot of difficulty or cannot do it all. Okay.
People changing their responses.
I don't know if that's possible. I think it just moves as more and more people answer. Yeah. Okay. So we have a look at the responses. It's the question was asking according to the Washington Group short set. So the Washington Group guidelines say that if people answer a lot of difficulty or cannot do it all, then they are more likely to be at risk of disability or to qualify as a person with disability. And most people have answered that way. A lot of people have also said that if people answer some difficulty as well, they could qualify, and that can be true as well. And I did talk a bit about that, about how programs are finding that often the some difficulty, it becomes a basket that collects people who really don't experience much difficulty, but it can also actually collect people who do experience difficulty too. So if you're at the stage of building more subtle and nuanced disability data collection systems, you could look at doing some deeper kind of analysis and analysis of people who are answering some difficulty, just to try and find people in there who might actually experience higher levels of difficulty than they're reporting. Okay, let's move to the next question. You are including the Washington Group short set in a form, but there is limited space. Do you change the response options to yes and no? We've got three options here: yes, no, and I don't know. Lots of responses coming in. That's great to see. And just noting that I don't know is a completely legitimate response. That's what these webinars and trainings exist for, is to help us gather, a bit more detail about an understanding of the complexities of the use of these questions that can appear so simple as, 6 questions, but actually there are lots of considerations and things to keep in mind. And so it's good to have the chance to talk and learn about them. All right, have a look at the correct answer is no. So the Washington Group short set stop being useful, really, when we change the response categories to yes and no. I think, as I said earlier, in situations where programs have changed the response categories to yes and no, it results in massive over-reporting, and to the point where the data becomes not particularly useful and also a bit strange. I've seen another example of where a program used yes and no, and 70% of participants said they had difficulty remembering and concentrating. So yeah, we really do need to keep the 4 response options. I know lack of space and time is an issue that people often bring up in the use of the Washington Group short set, but unfortunately, I mean, there are some ways that you can be clever about structuring or situating the questions within a bigger tool, whether it's a registration form or a enrollment form or a client information form or a questionnaire. There are some, you can use a table, you can shorten the look of the questions that way. But I think there's been quite a lot of testing of how long it takes to answer them, and it's only really about 2 to 3 minutes. They are the best, most effective option that we have in terms of identifying disability in a way that that is reliable. So so yes, we can't do a lot to shorten them or make them more time effective, and we certainly shouldn't ever be changing the response options to yes and no. All right, let's move on. There's just 5 of these questions, so we're halfway. You are reviewing a form used to collect demographic information about service users to monitor access. Do you include the Washington Group short set? And we've got yes, no, and don't know. Great, lots of responses. 42 people say yes. Let's have a look. Yes. 50, now 51. It's lots of people know the answer to this one, and yes. So if your intention is that you want to be able to look at your service users and understand how many and what proportion or percentage of them are people with disabilities, then you do need to include the Washington Group short set. That will help you understand your service reach a little bit in a bit more detail. It will help you understand, is your service reaching people with different kinds of difficulties if you go down to that level of analysis. So it's really useful to do that. It's important to remember that the way the questions are asked can result in better or weaker reporting. So in some countries where maybe literacy is a little bit less consistent, it can be, you can get more reliable data by having individuals ask the questions of service users. And that can include all the questions in a form or a registration form. In Vanuatu, that's mostly what we do. In the Vanuatu Skills Partnership is we have staff whose job it is, part of their job, to ask the questions to people who are seeking participation in skills development. And that's linked to issues around literacy and language as well. Okay, move on to question 4. Okay, you are developing an evaluation form for a workshop you're running. Will it be beneficial to incorporate the Washington Group short set? Okay, we've had some quick answers from a few people. Yes, absolutely. Yeah, and a few people saying not sure. And that yeah, it's also a very legitimate answer. Often in our evaluation forms, we want to keep them short. We don't want to burden people. We want people to complete them because we really want the information, or we want to hear from them and their perspectives after a training or a workshop or a webinar like this. And of course, if we include the Washington Group short set, it's going to make it longer. So I guess we need to go back and ask ourselves, is it important to us to know, to understand the difference, whether there was different feedback from people with disabilities compared to people who don't experience disability? If we, for example, really wanted to make sure that our webinar or our workshop or our training or our event was inclusive and accessible to people with disabilities, then I think we'd really want to include the Washington Group short set in our feedback form, because we want to then be able to analyze the results, to look at the feedback that came from people with disabilities and see if their feedback is any different to the feedback from people who don't experience disability. And the Washington Group short set will help us to do that. Of course, we can also have questions in the feedback form about accessibility and inclusion, and whether there was the right strategies were used to enable access and inclusion. But if we want to disaggregate or split our data so that we can understand the difference in experiences of people with disabilities and people without, then we need to include the questions. And that's the rule of thumb really for every data collection we're doing. We need to sit back at the beginning and think to ourselves, is it important to us to understand the different experiences of people with disabilities compared to people without? And if the answer is yes, then we probably need to include the Washington Group short set. Obviously, the answer was yes. Okay, last question. When I don't know whether to use the Washington Group short set or not, I will just not bother, just do it, or ask for help. Yeah, and lots of people identifying, asking for help, which is great. I love that no one said just not bother. Sometimes it won't be appropriate to use the questions, but it's worth having that process of thinking through your objectives for data collection and before making the call about whether you use it or not. And if you're just not sure, then asking for help is a really good idea. Where can you ask for help from? That's a good question. So some of you will have access to disability inclusion support or advice through people on your teams or in your programs. But of course, there are also OPDs, and I know there are several representatives of OPDs here with us today. Obviously, Lysa is here from PDF, but I could see in the participant list we have others as well. So OPDs can help you think through whether it's useful or not to be thinking about using the questions in your data collection exercise.
Thanks, Sal. And maybe I could add to that one that for Pacific Women Lead, we've made the decision to collect the Washington Group short set, as Sally did mention, when we're targeting individual women or girls. So when training is being delivered, when workshops or any sort of skills-based session is being, or service is being provided as part of the program activities, the use of the Washington Group we want to be used. When there are mass campaigns, so under our program, there might be a mass awareness campaign done for International Women's Day or 16 Days of Activism. And when Sally talked about sometimes it's not appropriate for Washington Group to be collected, that's an example under our program where we don't require Washington Group short set to be collected, because it's much more a mass community activity versus a service or a skills building or a workshop being delivered to particular women and girls.
Thanks, Emily.
Right, we might go to the other questions that we have. We've got about 15 minutes left, so I'm going to read through some of the questions. I wanted to just let people know that if you do have to leave early, we understand. We know that that's, you've all got busy lives, but I have put a link to our Zoom survey for this webinar in the chat. Please, we would really appreciate you taking a couple of minutes just to fill out that survey before you leave. So jumping back to the questions, I'm going to look, and we'll try to get through as many as we can. We do have a question from Joe, which says, would you give an example of qualitative data? So I might take this one and say, really, qualitative data, there's many different tools that you can use. At a program level for Pacific Women Lead, we use impact stories or story collections as a way of collecting qualitative data. And that means we're going out and talking to people, beneficiaries of the program, to ask them about their experience and also the benefit that they have received as a result of program activities. But there are other qualitative tools that you could use, such as key informant interviews or focus group discussions. Really, qualitative data is just about saying, go and try to understand the why a bit more. Quantitative are the numbers, how many people. The qualitative is trying to go out and search for the why or the what could we do to improve, that kind of information. So any questions or tools that you can use to gather that information is an example of qualitative data, and specifically trying to identify people who may be experiencing disability and asking them more questions around their experiences and the benefits is something that we're really trying to encourage partners to do. I might go to the next question. So would the same questions and template be used to identify a child's fundamental skills level of ability in education? Sally or Lisa, I'm going to throw that one to either of you.
I'll jump in on this one, and Lisa, if you want to add, please go for it. I think that one is from Jennifer, if I'm right. And
correct.
Thank you, Jen. Yes, great question. So yes, no, we don't use the same Washington Group short set well, hang on, I'm going to start again. We can use the Washington Group short set with children aged 5 to 17. However, there is the child functioning module, which has been developed by Washington Group together with UNICEF, which provides much more specific and nuanced information about disability amongst children, noting that sometimes children just develop a bit more slowly compared to other children, and that's not a disability, that's just the development track that they're on. So and I know, Jen, that you work within the Ministry of Education, so I'm just going to go a little bit more into this question. So the child functioning module / Washington Group questions for children have been successfully adapted within education management information systems in different countries in the world. Actually, the first country was Fiji, and Fiji's education management information system has a really great quality system for the identification of children with disabilities using the Washington Group child functioning module. And other countries in other parts of the world have now adapted this for their own locations. So I can share a lot more information about this with you, Jen, and I know you have my contact. So if you want that, please just let me know.
Thanks, Sally. Lisa, was there anything you wanted to add to that? There might be other. I think there's
that's all, Emily. Thank you for that, Sally. Yeah.
I think there's a good question here for you, Lisa. So some Pacific countries have established disability monographs after national census. Can you talk a little bit about this?
So very quickly, thank you for that, Emily. A number of countries, especially post MDGs since 2015 with the SDG. Every one country of the Pacific who have held census have used the WGSS, and that started with Kiribati and Palau in 2015. And out of the census data, they've developed a disability monograph, which is like a standalone report on persons with disabilities from the general population. And it uses it to identify the population most at risk and those who are identified as persons with disability. But the beauty of it is the report is based on functioning, the level of functioning and the degree of the disability or the severity of the impairment, with the comparison to population without disability and the opportunities, or what are the outcome, what is the education outcome for people with disabilities compared to those without a disability. So what is the education outcome like? What is their health outcome like? What is their living condition outcome like? What is their employment outcome like? And it shows the huge disparity between people with and without disabilities in terms of opportunities in all these outcome areas. So that's very briefly, long and short of it, Emily, and I could put a link on where all those monographs can be accessed through the SPC. You know, the stats division, it has, there's a number of countries has a monograph, including Fiji.
That'd be fantastic. Thanks, Lisa. Please do put that into the chat for people. Arti, I think there's a question here that you would be well placed to respond to. How can you capture types of disability through participant lists?
You will have to include the WGSS questions in your sign-in sheets or your registration forms. I also saw another question that somebody had asked about gender and disability as well. And I think when you will be doing the evaluations, you would see how we've placed those questions so that you actually answer it all, your gender, your age. And then when you answer the WGSS questions, then from there we will analyze. Are the age 37 answered a lot of difficulty to do you have difficulty walking or climbing steps? So then we would know that this particular person was a female aged 38 who actually has a physical impairment. That is how you would capture it. You would have to include these questions in all of your lists, whether it's registration, participant sign-in, as well as evaluation. Thank you.
Thanks, Arti. And there's another question that sort of follows on nicely to this one, Arti, so you might want to respond to this one as well. But a question that has been on my mind is, how do we tackle or gather data on those who do not wish to release their age at all? I understand that we give age range. However, what will we do with those who do not wish to reveal their age at all? Would this render your data a little compromised or vague when trying to capture the demographics, when you are trying to reflect the occurrence of impairments within a certain age group? How can we better address this?
It would to some extent skew the data that we collect, but we are also humans, and we need to understand that we need to respect how people respond to it. We can keep making individuals aware on why we're trying to collect this information, but we cannot force it on persons. So if they do not wish to give their age and that skews our data, then to some extent we have to acknowledge that we have to deal with that. I guess that's the word we will use. But yes, awareness, I guess, is something we can do before we begin the registration evaluation or whichever process where we are using these questions, but be respectful if people still feel uncomfortable about responding to that.
Thanks, Arti. That's a good response. So the next question, hi, this is Bernice from Fiji Women's Rights Movement. Part of our annual rape case analysis, we analyze court judgments. Is it helpful in any way to identify how many cases had victims or survivors as persons with disabilities, especially since the nature of crime is sexual crimes and sometimes against girls? We do get this data from publicly available court judgments. However, victims' names are anonymized, so we do capture it in our analysis. However, I'm curious as to whether there is any merit in highlighting this as an advocacy point to avoid risk of further harm to victims' survivors. At the moment, through the cases, I don't quite often come across access to justice issues, particularly dealing with persons with disabilities. So I wonder the value of highlighting how many percentage of total victims were victims with disability. Sally, would you like to respond to this one?
Yeah, I will. And then I'll be interested to see if Lisa would like to respond as well.
Yeah.
Yes, so I think you've raised a really, really important point, and that is that, broadly speaking, the incidence of people with disabilities, particularly women and girls with disabilities, reporting crimes and violent crimes is very low. There have been some studies that have shown there are many, many, many barriers preventing the reporting and the receiving of justice by women and girls with disabilities and people with disabilities. And however, I do think that data collection is probably a factor in here as well. I don't think that there are, within the justice systems, there aren't sort of strong, there's not a strong history of collecting disability data and doing that analysis to understand what, the numbers of people with disabilities who are accessing and receiving justice support compared to people who don't experience disability. So I think you're absolutely right. It is an advocacy point and a huge gap. Liza?
Thank you for that, Sally. Certainly, and numbers also, we must remember, is politics, but from a point of view of from an advocacy organization, it's important to highlight, because it will speak to what other kinds of intervention and how can persons with disability be supported better to access the justice system. There are gaps, and so those numbers would be very important, and it would greatly support advocacy for better services. Back to you, Emily.
Thanks, Liza. So the next question, thanks so much for the session. It's really great to have this webinar and guidance note on monitoring and reporting on disability inclusion. Has or is Pacific Women Lead planning to also provide guidance and support on other strategies for disability inclusion? For example, raising awareness on disability inclusion, including use of the Washington Group questions, either internally within organizations or externally. Actions to reduce barriers once people with disabilities have been identified, and working with OPDs. So what support is essentially available? And maybe I can respond to this question to say, for Pacific Women Lead Partners, we are looking at lots of different strategies. So yes, the guidance notes and the blogs, webinars like this, but also, as Arti spoke about, the deep dives that we have in our annual reflection and analysis workshops, which is our large yearly event where we bring partners together. Our next one is in September. And at those workshops, we have face-to-face learning sessions that Sally and Liza and Arti deliver specifically around disability inclusion. We've also been working to develop an online module on disability inclusion, which we will give all of our partners access to, and people can work through a self-paced sort of learning module online. And so you'll hear about that if you're a Pacific Women Lead partner. But I think also I would just say, if there are specific things that you're wanting support with, as Sally and Liza have both stressed previously, talking with your national OPDs, I think, is a really great first step. Noting that some OPDs really do struggle with resources in terms of just having the people power within the organizations to sometimes be providing support. And I think we need to be really mindful of that, and therefore be providing a budget, or thinking about that in the budgeting of our activities, where we might need to have a partnership, or we want a partnership with an OPD. Are we thinking about how we can pay OPDs for their time, essentially, in activities that they're working with us on? But you can also reach out to us. So you can reach out to myself. If you joined this webinar, you would have received an email from me yesterday sharing the slides. So you'll have my contact details, and we will always look to see how we can actually provide further support to organizations that are really addressing specific needs. But they're just some examples of the things that we are doing as part of disability inclusion. Okay, next question, just so that we get through as many as we can. Considering that we capture the Washington Group short set in registration, are we able to tweak the questions in the post-evaluation? Sally, do you want to take this one?
Yeah, I'm assuming that question is, about we're using the Washington Group short set at registration, for example, this webinar, and then we're using it again in evaluation. Is there a way of connecting those up so we're not constantly asking people the same questions twice? And I think my answer is no, but if someone's figured out a way to do it, I'd be really interested. I think in the registration process, we're collecting lots of information. So we are collecting names, we're collecting email addresses, we're collecting obviously, disability status and maybe some other demographic data as well. And then we're also asking questions about accommodation. So what adjustments or supports are needed to enable your participation in events such as this webinar. Whereas the purpose of the data collection at the end is we're collecting anonymous, I think, I'm pretty sure the registration form, the evaluation form's anonymous, anonymous information about your feedback and your thoughts on how the session went. So for that reason, we can't connect up the two data collection processes, and we do need to ask the questions twice, because we do want to know when we go and dive into that feedback information that you're all going to provide us, and thank you very much in advance. We want to look at that feedback. We want to divide it up and look at the feedback we receive from people who've identified as experiencing a lot of difficulty or more, and what feedback they had, and we want to compare that to the feedback from people who don't experience disability, and just check that we are is the feedback any different, and what could we be doing more to make the webinars that we're running relevant and inclusive to all people.
Thanks, Sally. There's a good question here that I'm going to throw to you, Lisa. So do you have experience or know of any studies that show the difference between using the word disability and special needs in surveys or conversations, etc.? I've heard that special needs is preferred and is a bit more positive than disability.
Not at the survey, probably, yes, in conversation, but as Sally has alluded to earlier, the use of when the Washington short set was tested, it's the use of those terms, whether it's disability or special needs, before those questions came out. And it's usually the
Lisa, your internet's a little bit unstable. So you're
the underreporting one is also the stigma. Okay, let me off my video. So in terms of special needs, as per the CRPD, we strongly suggest the language of the CRPD, even though in some of our countries we still have like special schools. But there's a big progress, for example, in Fiji, from crippled school to now special school. And so there's a progress in that sense. But then disability is still preferred over special needs, because you're boxing us into that box that we are different or we are special and need specific attention. We want to be in the same room with everybody else, but with the right support that will get us to be in the same room with everybody else. Otherwise, we'll continue to be segregated as in a special needs classroom, which is progressing slowly to mainstream. That would be my response to that, Emily.
Thanks, Lisa. Sally, did you want to add?
Yeah, thank you. Just to completely agree with what Lisa said, and just to add that the question asked about using the word disability or special needs in surveys, and I think and conversations, and Lisa's answered that point about using the terminology in conversations or reporting really well, that people with disabilities and OPDs would really like us to not use special needs and to focus on using disability language and disability first language, or disability rights language rather. But when it comes to surveys and using the Washington Group short set, we really need to not use any of those words. Yeah. So part of the reason the Washington Group short set is effective is that it doesn't mention the word disability anywhere. It asks people about whether they have difficulty seeing or hearing or walking, climbing steps, or remembering and concentrating. It doesn't ask about disability, and the introduction to the questions doesn't mention the word disability at all. So in surveys, we really need to stay away from using any of that language, but focus on asking people about what they have difficulty doing. Thanks.
Thanks, Sally. And I'm just going to ask one final question. There are questions that we haven't got to, but we are at time. But I think what we will do as speakers is we'll take the questions that haven't been answered and we will answer them, and we'll send them around to all participants who attended the webinar, because we obviously have your email address. But to complete, so I'm completing the survey, even though I'm not planning to leave yet, about the question about having difficulty communicating. A person whose English is their second language may answer yes or a lot of difficulty, which obviously points out a totally different issue. So Arti, did you want to respond to this question of Tamara's?
Sure, and Sally, correct me if I'm wrong. That question is based on the native language that you speak. If any other second language you have difficulties communicating with, that is okay. But if you have a lot of difficulty communicating in your native language, then that is where that question becomes applicable. Sally, anything you want to add to that?
No, that's exactly what I would say as well. Thanks, Arti.
Great. Okay. Well, we're going to end this webinar now. It's 8:32, so we're 2 minutes over time. Thank you so much for everyone who joined us. There were some great questions. There are some that we haven't got to, but we commit to answering them and sending those responses around to you by the end of the week. So let's say early next week, just to give us a little bit of time to do that. And please do take the time to complete the survey. The link is in the chat. We really do want to know what you thought about this webinar. We're looking at doing future webinars in the future. So any feedback from you for us to improve would be greatly appreciated. Any final comments from any of our panelists? I can see Lisa's just dropped out, probably because of internet problems that she's been experiencing. But any sign off from either you, Sally or Arti?
Yeah, that's right. Lisa had to drop out because of her internet, but she said to say thank you very much, and I echo that as well. Thanks so much for attending today and for your excellent questions. It's been a great session. Arti?
Same as Sally. Thank you very much for taking the time out to attend this webinar. Really appreciate that.
Okay. Have a great day, everyone. Bye for now.
Bye.